Episode 56 KS October 30, 2023. Poland Storm&DustNet, low-cost PM2.5 monitor network and rural children's health. Poland, Małopolska, Storm&DustNet, low-cost PM2.5 monitor network, rural children's health studied. Affordable air quality monitoring reveals rural children's exposure to harmful particulate matter. News Medical. Fine particulate matter that is 2.5 micrometers, m, or smaller, PM2.5, can have a serious harmful impact on various organs and tissues. Affordable air quality monitoring reveals rural children's exposure to harmful particulate matter. Download PDF copy. In a recent study published in Scientific Reports, researchers discuss the development of a low-cost air pollution measurement system and validate the system by measuring particulate matter levels across 4 years in rural areas frequented by children. Study: health risks for children exercising in an air-polluted environment can be reduced by monitoring air quality with low-cost particle sensors. Background exposure to ambient particulate matter in urban and rural settings is a major public health concern. Fine particulate matter that is 2.5 micrometers, m, or smaller, PM2.5, can have a serious harmful impact on various organs and tissues. Particulate matter of 10 m or smaller, PM10, has been the usual standard worldwide for measuring particulate matter levels during air quality monitoring. Most major cities in the European Union have at least one government-supported station for monitoring air quality. However, accurate systems for measuring particulate matter levels are expensive, which makes the establishment of such systems unfeasible in smaller towns and rural areas. Government institutions and various universities in the EU are involved in the development of low-cost air quality monitoring systems. These systems can be widely implemented in urban and rural areas to monitor air quality, which may ultimately lead to changes that can avoid potential health hazards associated with air pollution. About the study. In the present study, researchers monitored air quality levels from areas around schools in several villages in Małopolska Province in the Lesser Poland region. Particulate matter levels were measured using a new and low-cost air pollution measurement system called the Storm&DustNet measurement network developed in Kraków by Jagiellonian University. Other parameters such as air temperature, pressure, and humidity were also measured along with particulate matter levels using the university measuring stations that are part of the Storm&DustNet measurement network. The university measuring stations monitor the concentrations of suspended and airborne particulate matter of diameters ranging from 10 to 0.3 m. Measurements were obtained every 2 seconds to calculate the average measurements for each minute. University measuring stations were mounted in 11 locations across Małopolska Province, 1.5 to 4 kilometers from each other. All the locations were not in the proximity of roads or highways with heavy traffic. All stations except one were installed close to primary or nursery schools to monitor particulate matter levels. The last monitoring station was installed in a small village that was near green areas with a low building density. Oxygen Measurement eBook. Easily understand Dissolved Oxygen Measurement eBook. This eBook educates on basic information about dissolved oxygen, DO, measurement in a both brief yet understandable form. Download the latest edition. Air quality measurements were obtained over 4 years starting in September 2018. The study period included heating periods between the months of April and September and cold periods between October and March. The levels of particulate matter that children were exposed to were calculated based on measurements taken between 8 a.m. and 6 p.m. during the study period. Study findings. The concentrations of PM10 were often above the alert threshold of 50 g per m3, especially during the winter months, thus indicating a serious health risk to children exercising outdoors during this time. The highest PM10 concentration measurements were obtained from stations installed in a country town and close to primary schools during the cold period. The lowest PM10 values, on average, were obtained from stations installed near a primary school in a village or a small village close to a green space and without too many buildings. The average PM10 concentration values during the heating periods did not exceed 19 g per m3 for any of the stations. According to the United States Department of Health and Human Services, adolescents and children require at least 1 hour or more of physical activity, as physical activity levels correlate directly to overall fitness, strength, muscle mass, and resilience to stress. Children also have a high endurance capacity based on their maximal oxygen uptake. However, increased oxygen uptake during physical activity also increases their exposure to harmful particulate matter, as it deposits the particulate matter deeper into their lungs. Thus, increasing awareness about exposure to particulate matter and the regular monitoring of air quality levels is essential for the health of the population, especially adolescents and children. Conclusions. The low-cost system for monitoring particulate matter concentrations was effective in providing comprehensive measurements of air quality across 4 years. The study findings showed that children exercising outdoors in rural areas were exposed to harmful particulate matter, especially during the colder months, thus making them vulnerable to various health problems. Journal reference, Nikars, Z, Pavlak, K, and Zolads, J, A, 2023. Health risks for children exercising in an air-polluted environment can be reduced by monitoring air quality with low-cost particle sensors. Scientific Reports 13-1-18261. doi, 10.1038/S41598023454263. United States Insurance Company, Mercer Marsh. Supporting workers during wildfire events, Mercer Marsh benefits. Top health concerns include reduced lung function and increased cardiovascular risks due to particulate matter, PM2.5, in the air. Additionally, Marsh, United States, PM2.5 and health of Black seniors. Heat attack, Black seniors bear unequal burden of cardiac deaths from rising temperatures. The Hill. PM2.5, for their particle size of 2.5 microns, work to overstress the body's systems, particularly for people without air conditioning. And a 2023. California, Klamath. Public Health Update, Air Quality Ordinance under revision. Klamath alerts the proposed changes make the ordinance simple to understand with only 3 burning-related options: burning allowed, exempt wood-burning devices only. California, Santa Rosa. Santa Rosa firefighters halt blaze at Carriage Court Mobile Home Park. Headline: Santa Rosa Fire Department controls mobile home fire. No casualties reported. Damage estimated at $150,000 linked to a wood-burning stove. Colorado, Denver. How we measured air quality at the I-70 cover park in Denver's Elyria-Swansea neighborhood. Colorado Public Radio. For the second round of testing in June, we ran 3 low-cost monitors to measure PM2.5, a class of larger particulates also associated with traffic. Minnesota, St. Anthony Park. Wildfire season is over, but winter air quality still poses risk. Park Bugle. I miss the days when going outside in January meant only cold air in my lungs, and not smoke and particulates too. With smoke can make average air. Moderate air quality may not sound menacing, but long-term exposure to even low levels of fine particulate matter, PM2.5, can increase the risk of. India, Delhi. Delhi NCR's air quality remains very poor as national capital AQI breaches the 300 mark. Weather.com Derper's AQI, for PM2.5, was particularly bad and stood at 384. Articles from the Weather Channel, weather.com. India, Delhi. Why pollution in Delhi is rising despite fewer farm fires. The Indian Express. The primary pollutant in Delhi after monsoon rains is particulate matter, PM2.5 and PM10. Advertisement. These particles can be blown away by PM2.5 and oxidative stress. Exposure to urban nanoparticles at low $$1 concentrations as a source of oxidative nature. There is a growing scientific consensus that the capacity of inhaled PM2.5 to induce oxidative stress and inflammation in exposed populations may be